Well, the Nevada State Public Health Lab is studying a potential case of COVID-19 reinfection. This is after a 25-year-old man in Reno tested positive twice, once in April, recovered, and then tested positive again in June. As Kate Houston reports, doctors say this is the first of its kind in our country.
Dr. Mark Pandori with the State Public Health Lab says they now know reinfection can happen. What they don't know and what they cannot generalize is how often this could happen.
Here's what we do know about the case in Washoe County. The patient was symptomatic and tested positive for COVID-19 in April. After recovering, he was tested twice. Those came back negative. In June, the patient was taken to the hospital with symptoms and tested positive again. After analysis and identity testing, it was determined that the results were from the same person with a genetically distinct virus. Dr. Pandori says there are at least 3 other cases out there like this, 2 in Europe and 1 in Hong Kong.
As more and more of these cases start to crop up, and that will happen, what we will then be possible is we'll be able to try to determine whether this is something specific to the virus or whether it's something that happens rarely, as we sometimes see with other viral infections.
When it comes to vaccines and immunity, Dr. Pandori says we cannot generalize anything off of one case. As more cases are found, he says collectively that could have an impact on the development of a vaccine and how often it's administered. For those that have recovered from COVID-19, Dr. Pandori says they need to continue to wear a mask, frequently wash their hands, and distance themselves from others. Kate Houston, 8 News Now.